I'm Dr. Anthony. Let me share with you, in my experience, the most common causes of TMJD, temporomandibular joint dysfunction. The temporomandibular joint dysfunction is pain in the jaw. It can be caused by either major or minor trauma. Major trauma can be as a result of a car accident. When you're in a car accident, you can actually jerk your head, cause a whiplash injury, and the neck directly integrates the temporomandibular joint, and it can cause some pain in the temporomandibular joint. Minor trauma would be something as simple as maybe you have a complication where you grind your teeth at night, or maybe there's a little asymmetry in your jaw that causes some irritation and it leads to like sort of a chronic TMJ problem that you may have. Now the anatomy of the jaw, the way it works basically is you have the temporal mandible, so the temporal's up here, then you have the mandible and the joint, so it's the T, M, and the J. And when you have the dysfunction occurring, that's when you have the asymmetry that takes place. Some of the symptoms that are associated with TMJD can be everything from pain in the jaw, can be irritation that leads to headaches that are directly associated with the TMJ. Opening your mouth can be painful sometimes, so this can cause difficulty with possibly maybe make you not concentrate like you were able to prior to having the TMJ with work, or eating can become difficulty, so your diet gets affected with TMJ. Sleep pattern is affected significantly with TMJ. Sometimes if you have the bruxism, you can have a very difficult complication here. Another thing that we hear from our patients is the people that suffer with TMJ tend to be very irritable, impatient. So by having this pain, it sort of it gets to them emotionally, and it affects possibly their relationship with their spouse or their significant other, or even with certain family members. We have a great track record with helping temporomandibular joint dysfunctions. We have a specific treatment protocol that we use to help address this problem and to help prevent it from getting worse. If you do suffer from TMJD, give us a call and we'll be glad to help you. We can be reached at 215-743-5330.